Is that okay?
Yeah.
All right, I'm gonna start, and I just want to say thank you so much, ladies, for being here. I've known Margie forever. I have known Margie. She used to braid my daughter's hair. My daughter's almost 21. So I have known Margie forever and love her to pieces. I want to start singing that song, You and Me, Girl, Go a Long Way Back, right? And so Margie told me that she was involved in ECANA. ECANA stands for Endometrial Cancer Action Network for African Americans. And she is a patient advocate for them from her experience that she went through. And she told me that she had an amazing doctor. And then when I started my menopause group, she put the 2 and 2 together. So after she shares her story, I have Dr. Kemi Doll. Can you wave, Dr. Kemi Doll? She's waving, and she is a gynecologic oncologist in the UW Department of Obstetrics and Gynecology. She specializes in surgical and medical treatment of uterine, ovarian, cervical, and vulvar, I don't know if I'm saying that right, cancers. Dr. Dole earned her bachelor's degree from Duke University and her medical degree from Columbia University in New York City. We'll have to find out how she got out here to the West Coast. East Coast, West Coast. She is dedicated to improving the lives and outcomes of Black women with endometrial cancer and to reduce racial disparities. And I always said what ECANA was about. This is her brainchild, and she is passionate about bringing people together to increase awareness, supporting patient engagement and research, and just implementing actions where people can get better care, empowering Black women affected by endometrial cancer. So I just want to welcome both Dr. Kemi and Margie, and just take it away.
Yes, thank you, Diesta.
Thank
Yes,
you.
I've known Diesta forever. My daughter Tina is 41, and Diesta came with me as a chaperone for her 16th birthday. So I'm aging you, girl. That's how long we know. And I remember her pregnancies with both of her children, too. Okay, so I just want to start off with, I wish I had a journal right now that I could just kind of read from. So if you haven't started one, as this menopause thing starts, write a journal. Because I'm going to I've gone back in my memory to try to remember, because I believe my journey started around 38. I got hot flashes. My period wasn't weird yet, but I got the hot flashes, which was just like, just the night sweats and all of that. And I was just like, but I'm only 38. And I did have kids young. I had my first daughter at 20. And, but I thought, okay, I didn't know. And so I kind of researched a little, talked to my doctor a little, and I did some creams. And probably over the next 10 years, I probably did creams. And I don't think I took too many pills. I might have taken a pill here or there to try to help. And then I did a lot of natural remedies that I could find to do to try to help with the hot flashes. And then around my mid 40s, I want to say somewhere between 44 and 47, the crazy period started. I mean, it was like, I've always had long periods. So they weren't 7 days anymore. Now they're 10. And then I would go 2 months without anything. And then you have 10 or 12 days of just period blood everywhere. And then it was 2 months, nothing. And then all of a sudden, 5, 7, 8, 10 days, you would think you were dead. There was so much blood, just gushing and going, bleeding through my pads and bleeding through my tampons. And I was like, what is going on? Meanwhile, the hot flashes are still going as well. I'm trying to tell you the best of my ability of what I remember. It's been a while. And then also I remember somewhere in my 40s, I want to say my later 40s, I had fibroids. And if you've ever had fibroids, they, the doctors all describe them as a pimple. So they're like, oh, fibroids are hardly ever cancerous. There are hardly ever anything wrong. It's just like having a pimple, fibroids. Both my sisters have had fibroids, but okay, now it's my turn to have them. And those babies are painful. So my butt was at the doctor. I'm like, okay, go to the doctor, find out what's going on. So I went to the doctor's, got an ultrasound, and she said, okay, these babies are about a quarter size in width, and you have a handful of them, and let's just see what happens, kind of thing, you know. And I am a really healthy person. So I've never broken a bone in my body. I've never been in a hospital for anything except to have my children. And I had them both pretty natural and was home in a couple of days. And, you know, back in the 70s and early 80s, that was just like rare. I mean, literally when I had my second daughter, who will be 40 next month, they wanted to send me home the same day. I had her in the morning. They came in and said, would you like to go home? You're good. You can go home. I go, no, Mrs. Willis will be staying for her 3 days. And I had a toddler at home too. You know, Tina was just 2. And so, you know, I'm a healthy person. So I was like, okay, when the fibroids kept persisting, I was talking to a friend of mine who is a nurse. And she told me about this natural remedy I could do to get rid of my fibroids. So I did a heating pad with castor oil. I had no dairy and no seafood for 1 year. I'm sure I cheated, but for 1 year, and all the pain left. They were gone. When I went to my doctor, my OBGYN at that time, who I had regular appointments with. So EC, endometrial cancer, does not show up in a pap smear, because I had regular pap smears from, I mean, I have a history of them from like, I don't know how long, since I started going in. I did go a few years without going. I probably started going again in my early 40s. So, and I was 58 when I was diagnosed with EC. And so I did that. And so then when I went back to my OBGYN doctor, she said, how are the fibroids? I said, oh, they're gone. And I told her what I did. And she's like, I'm sure they're not gone. I said, well, they don't hurt. I'm not having crazy bleeding, you know, because some of that was part of it too. See, so all that starts going on, right? So the crazy bleeding had something to do with the fibroids too, and the menopause. So now I'm doubled. I got all this going on at the same time. So once the fibroids were gone, the crazy bleeding still happened here and there. Then I'd go 2 and 3 months with nothing. And then maybe 3 or 4 days of just heavy bleeding. And then it might go back to the month thing. And this went on, I feel like 10 years or more. And every time I would Google a symptom, it would say menopause symptoms. Oh, all these. And I'm like, well, this is all the things that I'm dealing with right now. And they all fell under menopause. So I do not know, and this is what I would say to everyone who's going through this right now. Listen, watch, be aware. Notice when you go 1 whole full year without a spot of blood, not even a dab or a dot. You don't want to see no blood, and know when that happened. Like, oh, that's the day it happened. That's one thing I can't say ever happened. But because it was 1 dot, I never said anything about it until it started getting heavier. And then I mentioned it to my doctor. And she's like, wait, what? And I said, well, you know, I mean, I've had a dot here and a dot there, but I figured I was just done. And she goes, oh, no, you should be done, you know. And then that's where she first, you know, did the ultrasound. And it took about 8 or 9 months for me to go through all the stuff before I finally got to the right doctor. Because during all of that time, I was moving to Seattle. I was in the middle of a divorce. I was teaching 15 classes a week. I was working with the Silver Sneakers program my life was full, but it was not focused on me. And it's so easy, I know all of you guys know this, to push ourselves aside. And being involved in fitness for as long as I have, over 30 years, the one self-care things that I did have going on was I did massages pretty regularly for my body. And then when hot yoga started, I started doing hot yoga. And I would just find little things I could do in little spaces of time. so that I could, try to take care of me. But little did I know that that just wasn't enough. You need to stop, listen to your body, and decide that you're going to pay attention to what's going on. But you have to realize that after so many years of talking to my friends and talking about, oh my gosh, when is this bleeding going to stop? Oh my gosh, isn't it over yet? Oh, there's menopause. Oh my gosh, the hot flashes. After a while, you feel like, I'm tired of talking about it. And so I got quiet. I just didn't say anything. And so once the bleed, I'm trying to think how many months the bleeding was off and on before I mentioned it to my doctor. I want to say maybe 3 or 4 months. It was like maybe 1 week I would have a spot of blood, and then 2 weeks nothing, and then another 3 days it would just be like, is this a period? What's going on? That kind of thing. And so I was finally diagnosed with endometrial cancer when I was 58 in October of 2016. And I remember this so clearly. After my surgery, my doctor said, I remember I'm just waking up and he's in the room and he's trying to give me, all the stuff that he found, oh my gosh, we just had to take everything. It was just crumbled in my hands. It looks like it's all contained and we don't have anything outside the uterine wall. I think we're good there. We'll check the lymph nodes. We'll get back with you in a week. I remember saying to whoever was in the room with me, I go, oh my gosh, I wish I would have done something sooner. I'm like, gosh. And then I just was kind of going over it in my head. And then he just said, oh, no. Had you come any sooner, we might not have diagnosed you. And being involved in ECANA, I've heard too many stories about that, misdiagnosis. And that's just how crazy it is, to where that when I finally did say something, I'm still thinking, oh, could I have said something sooner? And I didn't really say it to him. I was just saying it, in the room. And he was like, oh no, he goes, no, your timing was perfect. We found it was in a place. So it's like a sneaky hiding cancer. And that's why I say when it hid in my menopause symptoms, because every time I Google something that I thought was weird, it would say menopause, and at this point I'm like, okay, I'm not going to be like talking about this forever. And I wasn't in any pain, which is not normal. Most of the time you're in some kind of a pain, but I didn't have any pain. As you know, with the fibroids, had I had pain, I would have been at the doctor's every day because I can't function. You can't function with that kind of pain, as I did with my fibroids. I was like, okay, now I got to go and, find out what's going on with the fibroids. So I'm thinking, well, pain did not help me this time because it needed to help me do more quicker. I feel at least I would have been, I don't know, maybe a little weird. I don't know. It's all so hindsight right now. So I finished all my treatments in 2017, March. I was done. I had 4 rounds of chemo and 3 rounds of brachytherapy, which is where they actually, so intimate, they actually put this tube up inside your vagina and they just blast it up there with radiation instead of blasting your whole pelvic with radiation like some women do. And I met Dr. Kemi Dole through my youngest daughter, Ani, who had been working at UW 2.5 years before that. She ran into a doctor that knew Dr. Kemi, like her and Dr. Richardson. Is that her name? Tell me, Kemi.
Davidson.
Dr. Davidson. I just lost her name really quick. Ani met this doctor at Little Gym, and this doctor's daughter and Ani's daughter were doing gym together. I love how things connect. Thank you, Jesus. And I remember when I was looking for a third opinion, Ani texted me Dr. Kemi Dole's information and said, this office is going to call you. She will be your third opinion. Because by now I had talking to my surgeon. I'll share a little bit about that too, just so you guys know that you have rights. The first time I go see my oncologist, a friend was with me. Do you know, and I am not exaggerating, I was in and out of his office and he checked me in 15 minutes because he was talking so fast. He was talking from his medical book, just And my friend who was with me said, she doesn't know what that is. She was trying to stop him. Could you slow down? And I'm just sitting here like deer in headlights. Why am I an oncologist once I realized what an oncologist was? I don't have cancer. That can't be me. That was another whole journey, you know. And today, sometimes I still go, oh yeah, that was me, you know. That was me. This is my story, you know. So 15 minutes, I'm sitting in the office scheduling a surgery, which happened 2 weeks later. That's how fast it was. And on our ECANA page now, we have a whole list of know before you go, sheet you can print off and have all your questions ready. Always take someone with you. We have all of that information that I didn't know anything, you know, at that time, because I don't go to the doctors. I don't get sick. Why would I need to know that, you know? But yeah, so the saving grace for my fast talking, quick doctor is that he was a good surgeon. So praise God for that. He was a good surgeon, and my surgery went well. It was longer than they expected because the tumor that they found was bigger than they expected. And so my recovery was a little bit longer than we expected. And so then I went and saw the radiation doctor, and he was a lot better. He was more table manners, just talk and ask questions, let you ask questions, and it was just very, very, very personable. And then I met Dr. Kemi. I said, okay, I got my appointment within the time Ani sent me the information, I think within a week, I heard from Kemi Dole's office. And so I went in and I met Kemi, and my life changed, because here now I'm talking to a doctor who has pencil and paper, says 2 or 3 sentences, stops and says, questions. Did you understand what I say? Tell me what you heard me say. How does that resonate with you? What do you think that means? I mean, it was like a whole new world. I want to thank my daughter Tina and my friend Gail were with me. I feel like 2 people were with me at that meeting too. So between all of us, we were asking questions, and Dr. Dole is drawing pictures. Yeah, I probably still have those pictures somewhere. She's drawing pictures of everything that has happened. This was going on. So they went in, they took this out, and blah, blah. I mean, it was like, okay. You know, and since I've been involved with ECANA too, I've been at different functions and different conferences where a lot of the doctors are talking that, you know, we need to have living room conversations with our patients, and not just talking from our knowledge and our book and what we think, but actually listening to the patient. So after I left Dr. Dole, I was just like, okay. And I could literally, my daughter and I remember, we went over the notes that she had given us, looked at the pictures, and just re-talked ourselves through everything so we knew what was going on. I am like, I mean, I hardly ever take a Tylenol. I was like, no, I don't want no chemo. No, I don't want no radiation. Oh God, what's gonna happen to me? You know, and so Dr. Kemi felt that. So I want to say like 3 weeks after I saw her, I had my first chemo, and she was there. And my daughter Ani flew in too. She was there. But I remember just the calming and the peace. And Dr. Joel, you probably remember this. Ani and I were saying, because in that first meeting I had with her, Dr. Dole made it clear, you will lose your hair. So have a hair plan. And then Ani, I remember Ani, we're sitting in there, my first chemo, and Ani's going, so are you sure you're going to lose your hair? I said, well, she said I was. So when she came in the room, Ani goes, what are the chances that my mom's not going to lose her hair? Dr. Dole looked at her and said, 0. The hair's going. So what's your hair plan? And then Ani, okay. I looked at her. She looked at me. We said, wig? Scarf? And this was in October, so I had to go through the winter where it's cold. And that was just a funny thing. It was like, me and Ani still laugh about that today. We're like, she just plainly, there was no mixing of words. Like, I've already told you this, but she'd already told me that. But so that process of getting through chemo and radiation, it really went faster than I expected. And I love the fact that Dr. Kemi was so, she, after talking to me, she would remember things that I had said. She would remember like, I don't know if you remember, Dr. Dole, when, let's say it's going to be my last chemo. So after my third chemo, my white blood count dropped. I mean, really low. Because I think it has to be at 1.5 or 2.5 before they can give you chemo. So I remember I had gotten blood work on a Tuesday, and on Wednesday, the nurses called me from UW. And I was like, hello. And they were like, your blood count is extremely low. You're due to have your last chemo on next Thursday, because this was a Tuesday, so the following Thursday. And I said, okay, so we'd like for you to come in and take these shots. And, like, I'm done. I'm done by now. I'm just like, what? I want you to come in, take these shots. Oh, it doesn't look like your insurance covers it. About $2,000. But we really want to get your white blood count where it needs to be. And so I said, I think I'm going to pass on that. I just wasn't feeling it. And she called me 3 times. By the third one, the nurse's voice had raised. She was making sure that if my temperature went past 101, I think that's what she said, I had to go immediately to emergency, and it was non-negotiable. I said, okay. And so immediately I grabbed my phone and I Googled all the foods that build your white blood count, right? And I was already eating so many of them. So what did I do? I made sure I had them 2 to 3 times a day. All these, garlic was one of them, and spinach, just some different list of foods that were high in white blood cell. And so I did, and she goes, and then Kemi called me probably 2 days later. She goes, okay, I heard from the nurses. I heard what, okay. She goes, I totally agree with your opinion. This is what you want to do. I know how you are. I use essential oils too. Peppermint saved my life. I never threw up once, never had any nausea, because I had doused myself in peppermint and lots of water. And from one of the side effects from chemo I did not have. And she goes, use your oils, do you. And she goes, when you come in for your next, your last chemo, if your blood count is too low, we'll skip it and reschedule, or we'll just skip it and be done at 3. I said, okay, that sounds good. She goes, I just want you to know that, they let me know what's going on, and blah, blah, blah. It was great. So my friend Gail went with me to my last appointment. And so they had to take my blood. They take your blood right before you go in for your last chemo. And so we had 2 plans. Either she's going to be with me for the day for chemo, or we were going to go shopping. And so the lady comes and she calls my name, and she doesn't come over to me to dismiss me. She comes over and just calls my name, ready for you. And I was like, oh, wow, okay. I said, what was my count? She goes, just over 1 something, she said. I said, oh, cool. And then Gail was like, yeah, you pulled that up, She goes, what? The nurse was like, what? What do you mean? And then we told her what happened. She stopped in her footsteps, turned around, looked at me and said, what? And I was like, yeah. Yeah. She was like, no. And so the whole time she was with me, the nurse kept asking me, what were you eating? Tell me your diet. Da, 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 da. The whole time, it was great. It was great. And, now that I look back at this has totally changed my world. And that I know what an oncologist is, and I can say endometrial cancer, DSA. I can actually say those words. Girl, I feel you. All these acronyms I've learned, and my very last appointment with Dr. Dole, and I knew Dr. Dole was a research doctor, and I knew about research because my daughter Ani does research. So I know what they do, to build their teams and this and that. So for Dr. Dole's research, she actually needs patients. So she says to me, all the things I would normally tell a patient as they're leaving, you already do. So I only have one question for you. I said, what? She goes, do you want to be a patient partner? I didn't even know what it meant. I said, sure. 3 years later, I know what it means. So it's just been a great ride. So my ending words would be, pay attention so that you know when your cycle ended and that no strange bleeding starts happening after you're done, because you're completely done with menopause, when you see no blood for 1 year. Then but know when that happens, like be aware, take notes, write a journal, do something, put on the calendar. Because literally when I think back, I don't remember a whole year going by without a dot of blood. But who's going to say anything about a dot of blood? It was just a dot. Well, that year I only had one dot all year, one dot, and because uterine and endometrial cancer are so hidden and so quiet and so not talked about, because who wants to talk about bleeding? Who wants to say somebody, oh God, I just bled through all my clothes again? We just don't talk about it. And, so the goal of ECANA is to get the word out there so that women start making a conversation around uterine and endometrial cancer, which are so common. They're more common than people make it out to, because you just don't hear about it. But it is very common, very common. And Dr. Dole will have a lot of stats for you too. And then we'll just field any questions when Dr. Dole is done. Thanks, guys.
Thank you, Margie.
You're welcome.
I love hearing you tell the story because I feel like I always learn something new about what happened. I'm like, oh, did that happen? Well, I'm very happy to be here. Thank you, Diesta, for inviting me. And I think I'm actually just going to start with what I want you to know. And then I'll get into some of the details of the statistics like Margie said. But ultimately, I think that what you'll notice what you hear from Margie is actually you're hearing somebody who is very engaged in their health and their healthcare the whole time. So though, Margie was like seeing doctors and like you were still in care during your menopausal transition and you were in communication and all of those things. And when you listen, you actually hear somebody who it still took a really long time to really get an ultrasound, get a biopsy, and understand what was going on. And what we know about endometrial cancer is that most people aren't Margie. They're not in common healthcare, like constantly seeing, or, kind of in routine care, especially after childbearing. So especially when women are kind of done with childbearing, they're like, there's nothing else going on there. What we see is that we really kind of can take a step back from thinking of those reproductive organs we have in terms of their health, their ongoing health. And I think that's just a space where we end up with a lot of silencing and lack of information about the risks of endometrial cancer. And my goal tonight is not to scare anybody because that's never helpful, but my goal instead is to have you be able to think about endometrial cancer symptoms the same way we would think if you found a lump in your breast, right? Which is that everybody understands, hey, wait a minute. First of all, I should pay attention. Second of all, if I find a lump, I should pay extra attention because I don't think this is supposed to be there. And then you might notice the next day, oh, well, if it's gone, it left, it's gone, okay. But if it's still there, I should go get this checked out. And you understand that a lot of women have lumps and they may not have any problem. But if you have a lump, you need to go get the answer because it could be something more serious. And so that's really our goal at ECANA. And my goal tonight is to raise our level of awareness a little bit around these bleeding symptoms so that we can think about them in the same way. It's not that if you have a drop of blood, you have cancer, but let's think about this the same way and that let's get this evaluated. Let's get the answer as opposed to thinking that this is just normal or I'm just going to keep bleeding kind of for the rest of my life. So I have a few slides to show, not too many, I promise. But there are a few statistics that, first of all, can everybody see my screen? Those are nods? Okay, good. Y'all can see? Okay, good. I'm going to move you up here so I can see you. So this is from a talk that I gave called What Black Women Need to Know About Endometrial Cancer. And like I said, I'm not going to go through the whole talk, but I do want to just share a few statistics with you because if you're on this call, then you are in a place where you can learn something about this. And that already is going to start to transform what's happening in the national conversation and what's happening in among your own circles around the risk of this cancer. So the first thing that I want to tell y'all is that we need to start thinking about endometrial cancer the same way we think about the rest of Black women's reproductive health. So we know that in the United States, Black women, we have higher rates of fibroids, irregular cycles. In the setting of having infertility, we actually have worse outcomes with infertility and higher rates of early hysterectomy, which is in the news again. and has been going on among Black women for a long time. We also know all about the risks around delivering childbirth and delivering children and higher preterm labor and even maternal mortality. But what I want to offer is that in that same way that Black women suffer from this excess risk around reproductive organs, the same thing exists when you move later in life and you're dealing with the potential of cancers with ovarian cancer, cervical cancer, and endometrial cancer. And so the first thing is I just want us to kind of understand that this exists on a continuum, and what we see in endometrial cancer is kind of the end of that continuum. So endometrial cancer, I did not coin the term. I think it's terrible. It's very confusing. Nobody can say it. Nobody knows what it means. But the bottom line is endometrial cancer is a cancer of the inner lining of the uterus. I don't think you can see my mouse, but it's basically, you know, when you get a pap smear, that pap is of the neck of the neck of the uterus, like what you can see from the vagina. The endometrial cancer is inside the womb. It's the lining. I tell people it's like the mattress in your womb. That's your endometrium. So an endometrial cancer is something that arises way up there in the uterus, which is why bleeding is our primary hint that something might be going on. Okay, so there's about 63,000 cases of endometrial cancer a year, and overall it has a fairly high, for us, that's how we think of as cancer doctors, pretty high survival, in that over 80% of women who get a diagnosis of endometrial cancer are going to survive their diagnosis. So I want to talk a little bit about the commonality and then what's going on with Black women. So I think something to understand about this slide is, like, don't worry about like all the statistics, but what I think is really important to understand here is that for White and Black women, the frequency, so this means like how often endometrial cancer happens, is about the same. So it's somewhere around about 1 in 37 women. So Black and White women will get endometrial cancer about the same rate. And in the United States, actually, Hispanic women and Asian women have lower rates of endometrial cancer than White and Black women. We don't know why. We're trying to figure that out. So it's actually Black and White women who are most at risk in general in terms of getting endometrial cancer. I'm pointing this out because everybody knows about cervical cancer and everybody knows about their pap, like Margie was talking about. They go every year, I get my pap, I'm fine. But endometrial cancer is actually 4 times more common than cervix cancer, much more likely to affect a woman in her life than a cervix cancer is. There's almost 250,000 endometrial cancer survivors in the United States. Only 46,000 of those are Black women. So that just starts to tell you right there what's going on in terms of the difference in mortality. Overall, it's about 1 in 37 women are at risk of being diagnosed with endometrial cancer. So this is why we try to say that it's common, not because we're trying to scare anybody, but we're just trying to establish that this is not something rare that you've never heard of. It's unfortunately something common that we don't talk about. And as a gynecologic oncologist, I see women with endometrial cancer all day, every day, all the time. But it's not something that's talked about, especially within our Black communities, and that needs to change so we can save women's lives. So prognosis, over 80% of women survive their diagnosis, which I just said, but unfortunately, it's not the same for Black women. For Black women, the mortality is much higher. This graph that I'm showing here, the line represents basically how many women are dying per a certain group, per 100,000. And you can see what's happening with White women, other women of color compared to Black women. Black women have a 90% higher chance of dying of endometrial cancer than all other groups of women. That's what we're committed to changing. And so this disparity, so when people talk about Black women's health, this is bigger than what you see in breast cancer, in cervical cancer, in colon cancer, all these things that we hear about all the time. Chadwick Boseman, people talking about colon cancer among Black people. I just want you to know, endometrial cancer, that difference is worse. So this is an area that as a community, we can really start to rally around and change what's going on in terms of awareness. There's some slides I'm going to skip for time. So in summary, I was trying to pull in some very basics, that endometrial cancer is common. 1 in 37 women, Black women, will be diagnosed, and that we have the highest chance of not surviving right now. This talk, I'm going to focus on early detection because that is one of the main modifiable factors that change survival. Catching an endometrial cancer early in its early stages is oftentimes the difference between having treatment that begins, ends, and that you move on from and survive versus having treatment that unfortunately does not work, that might prolong your life, but ultimately the endometrial cancer wins. And so that's why I like to focus on early detection when I'm doing community talks. This is basically saying that stage of diagnosis really makes a difference. So stage of diagnosis is what determines your survival in endometrial cancer. And that's like whether the cancer is contained in your uterus or it's spread further out. And here's the thing, in every age group, for every type of endometrial cancer, Black women are diagnosed at more advanced stages, later in the process, when things have spread further beyond, okay? And that is a problem because that's what's driving that big difference in survival that I showed you. And that's where we have an opportunity to take action. So what does action look like? What does that mean? The primary symptom of endometrial cancer is, as Margie said, an older woman who has gone through usually the majority of the transition of menopause, has stopped bleeding, usually for at least a year, and then the bleeding restarts again. It's usually not heavy. And actually, Margie, I have to correct you, it's usually not painful. It's not painful. It's usually painless spotting. That is a sign of endometrial cancer. I can't tell you how many women have told me, I did not know that. Like, nobody, what are you talking about? But that is, as a gynecologic oncologist, that's like the first flag. Hey, come look at me. It's like finding a lump. When that happens, we can do an ultrasound, we can do a biopsy, or we can do something called a DNC that then can help us determine why the bleeding is happening and either confirm or rule out and say, actually, this is not an endometrial cancer. Sometimes we can also find a pre-cancer lesion that's not cancer, but because we found it, we can do something about it and prevent the cancer from happening. This is just some research that I'm going to skip past given our time here. But basically, what I found in my own research is that even when Black women do come and present their symptoms, they don't get these biopsies and ultrasounds at the same rate that white women do. And that has to do with the problems we have in the healthcare system of taking Black women's symptoms seriously and acting on them appropriately, which is why we have to be empowered to do that for ourselves. Apologies for the skipping. The other piece that's really important, right, is that because we know we have high rates of fibroids in our community, because we have high rates of irregular cycles in our community, we have this issue with normalizing bleeding horribly, bleeding heavily, bleeding painfully as just being a normal part of life. And so what I see in my own practice is that because somebody said, you know what, in my 20s and 30s, I can't even tell you what those periods were like. So even now that I'm 58, 60, 62, this couple drops of blood is not a big deal. Like, this is nothing compared to what I used to deal with. The only problem is that is a problem because that is what leads to delays in going to the doctor and getting biopsied. And it's not our fault, right? It's not about fault. It's about not knowing that endometrial cancer is a risk. And it's about being used to, frankly, a substandard of care. Like, we're used to having to just deal with these crazy cycles as opposed to having them managed and having more options for having more healthy, controllable cycles during our reproductive years. So we did an interview study where we asked Black women like Margie about their experiences before diagnosis, because what I really wanted to do with this research is try to explain to the larger medical community what's happening among Black women before they even get to the doctor and say, hey, I think I might be having bleeding. That's a problem. I'm not sure. You know, and what we found is that a lot of women told us, it's not like I didn't know I was bleeding. It didn't feel like a new symptom. It wasn't bothersome. Like Margie said, it's not painful. And then the women told us, you know, somebody told me I had fibroids before, so I assumed it was from my fibroids, right? And so what they would tell us is that, you know, well, I just figured it will go away, or I will wait and see, well, if it lasts 6 months and I'll go to a doctor, or I'll just check in at my next visit. So it's February, my next visit's in October. I'll tell my doctor then in October. And all of that comes from the lack of awareness about the fact that, like the breast lump, right? You don't know what you don't know. So you think this is reasonable to wait, but it's not reasonable. The other thing that I want to say, because I don't want this to go unsaid, I'm very much into empowering ourselves, empowering our community, but I don't want it to go unsaid that we also unfortunately heard consistent stories of healthcare providers having been told, hey, I think I'm having some bleeding, and response of, oh, okay, well, sometimes that can happen. Or, oh, well, maybe maybe we'll just get an ultrasound to get it checked out. Now, technically that's true, but what does that mean to you? If somebody says, oh, we'll get an ultrasound to get it checked out, and you're getting a divorce, you're moving across the country, I'm talking about you, Margie, you got to work, you got to all this stuff. How do you know how to prioritize that, right? That just sounds like you're checking a box. Now again, I'm kind of keep coming back to this example. Contrast that to you have a lump and somebody says, oh, we need to do a biopsy. Girl, you're not waiting 8 months to get a biopsy. You're like, well, when is the biopsy, right? And so that's where I want to say we want to empower ourselves, because right now, and I'm working to change this, we also have a medical workforce that doesn't have the right sense of urgency, especially around Black women who are coming in with these symptoms, because we know the disparities exist and we know that the risk is higher. Okay, so now we get into like the empowerment piece. I didn't want this all to be like Debbie Downer, because we can do something about this. So ECANA is the group that I co-founded with Margie, along with a woman named Bridget Hempstead, which is about everything I said. We are about having visible community of endometrial cancer survivors like Margie, so I can stop giving talks and having women tell me they've never heard of this before. We want to be able to have this be a normal piece of conversation, to be able to say, hey, I might be having some bleeding. I think I need to get it checked out. We want to educate our community about what the signs and symptoms are so they can get checked out, but also educate the healthcare provider workforce about, you need to ask women these questions. You can't expect women to run in and just tell you everything that's going on with them. You have to be able to say, hey, this is a problem. I want you to tell me about it. And then also, we're really committed to doing the kind of research that we need so that we have more treatment options, and that no matter what stage a woman is diagnosed, she has a better chance of surviving. So that's our picture. So on our website, we have a lot on the website. Everybody can check it out. It's ECANAwomen.org, ECANAwomen.org, no www. But we have videos, and the videos are for this reason. So we can start to have faces of survivors. So we start to have this normalized, that people can have this cancer. We have a lot of educational content. This Learn the Lingo is my favorite thing. On the website, if you hover over each of these cards, they turn and they tell you the definition. So you start to understand like what's normal, what's not normal, it gives you more information. We also have downloadable worksheets. So if you have abnormal bleeding, or you have a friend and you're like, girl, what's going on with your bleeding? Like, how come you always go to the bathroom? Whatever it is, they can actually download a sheet that we have that has questions for their doctor to answer to ensure that they're getting worked up appropriately. There's Margie's cute face. So lots of information there. We also have wellness articles on there. We have the videos. Let's see, what do I have next? And then of course, there's Martha Jean. We also partner with researchers. And again, I don't have time to go into that as much tonight, but we partner with researchers because we want to be at the table when these research questions are getting asked, so we can answer the kind of questions that are really important to Black women. Again, so we can have more treatment options, earlier detection, better strategies. We do a peer education program that Margie graduated from, where we have women do education sessions in their local community, and they're able to talk and share this knowledge. We did 1 year of this program and are very hopeful to get funding to continue to do it in more areas of the country. We're in 11 different states in 2019. And then we have ongoing just programming to support women at any phase of where they are in their endometrial cancer diagnosis. So just diagnosed, going through treatment, after treatment, and Margie does the majority of these on Fridays to help women with gentle movement, but also give support. And then we have some themed weeks where we do meditation, there's sound healing, there's all sorts of wonderful things that are happening. Again, trying to create more of a community so women don't feel so isolated. So here are my action steps for Black women. So one thing I have to say is that, you know, I really do deeply believe that there's no reason that we should normalize suffering from the very organs that we kind of define ourselves as women by. I think that I certainly remember learning that as a young girl and as a woman, like, this is just it. You just suffer. We just have these kind of crazy periods. And that needs to change, because it sets up a lot of vulnerability later on when problems happen and we just have gotten so used to being in pain or so used to dealing with these heavy cycles. So actively managing irregularity with your menstrual cycle is important. And keeping a relationship with a high quality OBGYN during menopause is important, Because as Margie said, there's a lot that happens during menopause. Y'all know better than me. I'm almost there, not quite. I'm getting there. But there's a lot that happens. So what you want actually is, I actually don't want women to feel like I've got to journal every single thing. What I actually would want is active, high quality relationships where you have somebody who's like, okay, you're doing fine. But that same person can say, you know what, Margie, it's been like 6 years. Are we sure you should still be bleeding like this, right? So that's the kind of relationship that can help detect, like, this is a little irregular. This is a little out of order. Maintaining a healthy body weight is good for everything. So I'm not going to emphasize that. But I do want to say that when you Google endometrial cancer, you might read a lot about obesity, and there's a lot out there. And certainly maintaining a healthy body weight is helpful. But for Black women in particular, it's not obesity that's driving Black women dying of endometrial cancer. It's everything that I said before. And then what we like to say at ECANA is be aware and seek care, which means that, you know, empower yourself if you're having these symptoms to seek care. Other symptoms of endometrial cancer, other than bleeding after the time of menopause, for younger women, it's incredibly heavy, very prolonged cycles, especially when they've changed. So when they go from having fairly regular, whatever their regular is, to something that shifts into heavier, longer, prolonged cycles. That's what happened to Aminatu So. I don't know if you all know her. She's an amazing podcast host, does a lot of other stuff. And she was diagnosed with endometrial cancer in her 30s. And she was at the point where she was going to the emergency room and getting blood transfusions almost every other month for her period. And yet, despite that was happening, do you know how long it took a medical professional to do a biopsy and say, wait, maybe this is beyond normal. Maybe this is too far. That's what I mean by the normalization of suffering when we talk about our reproductive organs. That's insane to be having blood transfusions every other month. That is wildly abnormal. But I can't tell you how many women have told me about that. Oh yeah, this was normal for me. Anyway, so being aware and seeking care. Oh, I was talking about symptoms. So postmenopausal bleeding, really, really heavy, out of control, irregular cycles. The other ones are pelvic, like new pelvic pain, pressure that just like, it doesn't go away. And the usual reason why you can tell this is because it actually changes your bowel or your bladder function, because there's basically pressure there from tumors growing or something like that. So we see that. And then sometimes we also see bleeding after intercourse as people's signs. So that's kind of the thing where that is the first symptom that they notice. Those are the primary things, but I will tell you that for endometrial cancer, unlike sometimes the other ones, it's the bleeding. Like it's a real, that is the main sign. Okay. So during or after diagnosis, to let everybody know if anybody is affected or somebody that's affected, we also at ECANA, we talk about you deserve excellent provider communication, somebody who listens to you, who trusts you in your experience, and who explain things for you until you understand. After, and Margie knows this, endometrial cancer, after diagnosis, it's a complicated world. There are a lot of different types. There's a lot of different treatments. There are a lot of different signatures of different kinds of tumors and all of that stuff. Navigating that is not easy. Again, it's why we have our website to try to educate women, but being able to be active and understanding what risk you fit into and what you should or shouldn't be getting is also really important. And then of course, ensuring that you have support from loved ones and a larger endometrial cancer community. I thought I had this slide. So this is actually examples of the worksheets that we said that we have on our site. These are downloadable PDFs. Please feel free to share them. DS that you can share them. Like I just want them out there. Where if a woman's diagnosed, there's information about chemo and radiation. But again, even for anybody who's just having abnormal bleeding, we have one of these. What kind of bleeding are you having? What kind of doctor are you seeing? Where, and then it goes all the way down to make sure that you understand what is the final diagnosis. Okay. And then, these are just to say that we're getting a little bit better with awareness. I think a lot of it's because ECANA has been making lots of noise. But, you know, there was an article in Mother Jones about endometrial cancer. You know, the Society of Gynecologic Oncology started talking about it a little bit more starting last year. BET did a spotlight, which I just I couldn't believe it, but that was really important. So we have a long way to go, to be honest. I mean, there was just a cancer disparities report that was put out today by like the American Association of Cancer Research, and they ignored endometrial cancer. So I was on Twitter all upset. So we have a long way to go, because unfortunately, when it's primarily Black women who are the ones that are suffering from a condition, it takes a lot more. It takes a lot longer for that condition to be highlighted and emphasized in general, which is why I do the work that I do. All right, that's all I have to say for tonight, and I'm happy to take any questions in our last few minutes. Is anybody talking? You might be muted.
I just wanted to thank you, Margie, for your story, your bravery in telling your fabulous story. And Dr. Kemi, thank you for some valuable information. It was fantastic.
Thank you so much.
Thank you.
I have a question, Kemi. So
Yes.
I am one of those women who don't go to the doctor on a regular basis because I feel great. And I've been through menopause already, I think 2011. So it's been a long time. So any advice or anything like that? Because again, I only go like if I am like I just fractured my wrist last year.
Yeah.
Last time I went into anywhere. But other than having kids, like Margie, never an issue. Never went.
Yeah. So this is what I would say. So everybody kind of has their different threshold of like how they want to be at the doctor or not. I have patients, there's nothing wrong with them. They still want to come see me every month. I'm like, we're not doing anything. Why are you here? Right. So I recognize that there's that, right? And then there are people who just won't go no matter what, right? And everybody fits in the between. So this is what I would say, in terms of reproductive health, like the reproductive health, in terms of having routine exams or just routine visits with a women's healthcare provider as you age, it starts to come out a little, it starts to expand out a little bit more from making sure you don't have, an STD infection or making sure your pap is fine, out to thinking about things like bone health, thinking about things like cancer screenings as you get older and older, and the risks of those things go up. So that these visits, I like to remind us that these visits aren't, they don't have to be problem focused. They actually tend to be more about just how are you doing and are there things that we can do to promote your health? And part of that is the kind of screening for symptoms to make sure that there aren't things going on that we should act on, i.e. new bleeding, new pain, new bloating, those kinds of things. And so I would just offer that, especially for a woman or a person who's used to I went to the doctor when I had my kids and basically only when I have problems. Going to the doctor can feel like, what am I doing here? I don't have any problems. But as you age and go on in life, there's actually, I think, quite a lot of benefit to once a year check in with women's health provider that can just do more of a holistic look on, hey, how you doing? How's your calcium levels? Let's talk about where are you at with exercise? It's a really different kind of visit than what we're used to when we've only gone to the doctor for problems or for childbirth. So that would be that's my PSA, Sherry. That's my plug to give it a chance. Okay. And I would say beyond that, at the very basics. So I would say beyond that, the very, very basics, mammograms every other year are really important. Colonoscopy screening starting at age 50, but age 40 or 45 for Black folks, i.e. Chadwick Boseman. So that's really important. And then in terms of the rest, it's about being willing and being aware of wanting to seek care or seeking care if something really changes for you. Because I think what happens a lot with aging too is everything, like Margie said, can get put under the thing of, oh, I guess I'm just getting older. And so it really breaks my heart in my own practice when women come in and they've had symptoms for 6 months or a year and they just thought, oh, I just figured I was getting older. And I think that just having a touch point with somebody that you relate with, that you get along with, where maybe 40% of the visit or half the visit or most of the visit is just chit-chatting, that can really prevent those kinds of delays because you have a place to go if something goes a little off, without having to say, oh, now I got to find a doctor and I got to do all of that. It's like having a home to go to and you can just pick up the phone and say, hey, something might be a little bit off. Let's just check this out. So that's how I would answer that.
Oh, thank you so much. Good
Yeah.
talk.
Dr. Dole, this is Diesta. I wanted to ask you, does every stage of endometrial cancer require chemotherapy? Like if you catch it?
Oh my gosh. Great question. No. No. So in endometrial cancer, there's stage and then there's the type. So they're a little bit different. So you can have an early stage cancer that still requires chemotherapy because you have a higher risk type. That was Margie's experience. Those higher risk types, however, again, like, you know, kind of they can come with longer delays in diagnosis. However, there are a lot of women. In fact, I mean, a lot of women, at least probably half of women who come in early with a stage 1 cancer, all that they are treated with is surgery. So they have a hysterectomy, it removes the cancer contained in the uterus, and they don't need anything else. And yes, it's interesting because I actually think that's part of the reason why we don't hear more about endometrial cancer. Because if women don't want to go around try to explain to people this word they can't even say, and I think a lot of women have told me too, they don't like, is this because of my sexual activity? Like they don't know why they got it because we don't know anything about it. So there's like a shame factor. So then it just becomes, oh, I was bleeding, I got a hysterectomy. Oh, I had fibroids, I got a hysterectomy, right? And so the diagnosis gets silenced. And so even though, like I said, the numbers are so high, I mean, it's so common, you don't hear about it. And I think part of it is because for a lot of women, they just have surgery, which is great for them, but it's not good for our general awareness of like that this is really a life-threatening condition and that we can do something about it and get more people diagnosed early.
Go ahead. In those operations, do the ovaries always get taken out or do they just take the uterus?
Depends on the age. So
Okay.
if you're before your natural age of menopause, we usually would leave the ovaries in so that you can continue. It really depends on the age though. And then it also depends on the type. So there are some lower risk types of endometrial cancer where we can leave the ovaries in for younger women. And then but older women or higher risk types of ovaries do have to go. So again, this is what Margie was talking about, that communication is so critical. There's no one size fits all.
I have a question.
Mm-hmm.
Okay, I'm 63 and, you know, it used to be that you got a pap smear once a year. And now they're telling me, oh, you know, it's once every 3 years. And so I'm wondering, is that normal? I don't have any of the symptoms or anything. So is that what they say if you don't have any, you know, symptoms that they have to worry about?
Yeah, so the PAP question is, I'll try to make it simple. So before with screening, all we had was the PAP, which is we scrape some cells off the cervix, we look under the microscope, and we say these do or don't look normal. And so the reason why women got PAPs every year was because that's the best that we had, and that actually what it turns out is that the PAP smear can miss a cervical cancer. But if you do it every year, even if you missed it last year, you'll catch it the next year before it really grows. So that's why the PAP was every year. But now we have the PAP and we have HPV testing. And the HPV testing actually actually gives you whether or not you even have the virus that causes the changes in your PAP to begin with. So because we started to do the PAP plus the HPV, for women who don't have HPV, who are HPV negative, and they test that off the PAP. So they might be telling you, oh, you're getting a PAP, but what most women are actually getting is a PAP plus HPV. If the HPV is negative, you don't need to get a PAP every year because you don't even have HPV, and it takes like years for you to get HPV and for it to develop into something. So that is why you keep hearing how we went from once a year, now we're doing every 3 years, now we're doing every 5 years. That what we're doing has actually shifted, and we're not communicating that very well. So women are feeling very vulnerable. They're like, I'm supposed to be getting a PAP every year. Like, I'm trying to take care of myself and you're not letting me. But what's true, what's underneath that is that there's another test happening that's also helping stratify your risk. Having said all of that, the way these guidelines are made, they're made by looking at like hundreds of, like the whole population and saying, overall, we could probably get away with testing this little and not have this many more people die of cervical cancer. So it's kind of like this balance, right? So I just want to honor that because we know that there are certain subgroups that are higher risk. And what we have not done a good job of is saying, but wait a minute, if you're in this group, you might need a PAP every year. Like if you, and oftentimes those are women who have poor access to healthcare. There are women who come from different areas. So depending on where you're from, like there are different rates of HPV. And so I think that the balance is a little skewed right now to like, nobody ever needs a PAP ever because we're missing people. But every 3 years is very reasonable, especially if your doctor is doing the HPV co-testing, because then you really don't need it more often than that. And it's highly likely that they are doing that.
Okay, if I have like a My Chart, app and stuff. Would that be on the results from tests? Like if I wanted to look back and see if that was actually tested, I should be able to find it. Okay.
It should be.
Thank you.
Can I ask a question?
Yeah, so then I have to go because I promised my son I would tell him good night.
Oh, okay. So that HPV test you were just talking about, is that a blood test that gets normally taken with a normal routine?
They test it off. They can test it off the PAP. It's a test that they can take off the PAP smear fluid
from the
itself.
PAP. Okay, I don't even remember the last time I had a PAP.
I think it's possible they can also test it in the blood. I can't remember, but most of the time we do it off the PAP.
Okay. My question is, I'm 71 and I do keep in touch with my doctor, but do you think and I haven't seen a OBGYN, gynecologist in a lot of years. Do you think it's necessary for an older person like me to be seeing a gynecologist?
No, you don't need to see a gynecologist every year. If you have a medical home and a doctor that you can go to if you have new symptoms or different symptoms.
Yeah. I don't even mean every year. I haven't seen one in probably 30 years, long time.
Well, you asking a doctor. So I'm going to be biased, but similar to what I told Sherry, right? Which is that you might be missing out on some very simple, very easy health promoting things that we do or screening things that we do that can decrease your risk of problems for things that happen as we age. And that's really the function of the visit as you get older, is really, it's not about trying to find problems. It's much more about promoting your health and keeping you healthy as long as possible. So that's what I would say. I don't think that you need to go to the gynecologist every year and get an exam at 71, but I would recommend that you have an annual visit or just establish at least one time a checkup with a women's healthcare oriented internal medicine primary care doctor, so they can just do the basic screenings that we do of say, okay, you're good, everything. And they might tell you come back in 2 years. But if it's been 30 years, then there probably are some benefits to getting checked out.
Okay.
Okay. I gotta go.
Dr.
Can't
Dahl,
disappoint the 5-year-old.
Thank you so much, Dr. Dahl, for being here. Everybody come off mute and give her a round of applause, please. Thank you so much, Margie. Thank you.
Thank you.
God bless
Awesome.
you,
You guys
Margie.
are awesome.
So much.
Thank you.
Thank you for the work you do.
Thank y'all. Y'all have a blessed
Bye.
evening.
All right, thanks everyone.
Thanks, Diesta.
Thanks for being here, you guys. Wasn't it good?
Thanks, Diesta.
Yeah.
Very good.
Oh my goodness.
Absolutely awesome.
It was so
Thank you,
good.
Margie, for your story.
You're
Yes.
welcome.
Yeah.
Y'all stay well and stay brave. It was awesome.
Wasn't it awesome? Oh my goodness, she's so good. And Margie, thank you for just taking the time to talk and share your story. And Dr. Dole was awesome. She was amazing.
Amazing.
And so some people had a hard time with the password getting on. Dale, you tried it a second time and it worked. What did you do the second time?
I think you sent me a different link. I think it was just the last link you sent me that was okay. I just got on the last one that I was trying, the one you sent me last week, and it just didn't work.
Okay. All right.
Mine didn't open, and I finally got in and did what you said and went to the browser, but it still wouldn't open. Then I had to email it to myself, and then it opened.
I had the same problem.
I emailed it to myself.
Yeah, I just went on I ended up going on my laptop to the email link that you gave me, and that's how I got in, but I couldn't get in
as well and couldn't use it from email. So I just got
weird.
with the last
Kamaria, did you have any problem getting on? Kamaria's on mute. Did you have any problem getting on?
No, I didn't, but I used the link that you sent my phone.
Yeah.
I
Yeah,
don't know if that's why.
that's weird.
I sent that same link to everybody, and so my phone was like buzzing off the hook. So I was like, I'm blowing up for all the wrong reasons.
I didn't want to miss Margie, so I'm glad I got on.
But ladies, I just appreciate you taking time just to learn about endometrial cancer, because even though it might not be for us, but you never know who's going to be in your life that says something about it, that doesn't know, and girl, my period, it's just kicking my butt, and I thought I was done, and and now that you have knowledge, you can be like, hey, well, the things that you're saying, don't blow them off. And I think that we women, we just puff through things, we just we just keep going.
Diesta, did they say that is it hereditary at all, or is it just?
Margie, can you answer that?
I know it's not. It's not hereditary.
Okay.
It's not. Yeah, and a lot of cancers aren't either.
Right.
Yeah, but endometrial isn't. And the history of it, like maybe if you have it in your family, doesn't mean that someone else might get it. No.
Okay.
From what I know, it's not hereditary.
Okay. Good.
Okay. Any more questions for Margie?
I have a
Margie.
question.
Margie,
Yes.
I just like the way you took control of your life and the way you handled everything. It just speaks volumes that you had the courage to do that as well.
I know, and it took a lot.
Mhm.
It took a lot of courage that I didn't even know I had.
Right.
That's for one thing. You just realize what you have that you didn't know was there until you have to go get it.
Exactly.
And Margie, when you hear the cancer word, just hearing that word from your doctor, some people just fall apart and they can't, you have to change your mindset,
Absolutely. Because like I said, even today at times I'll say, oh, that was me that happened to. Because it was, before I'd be in a room and, several people around were talking, especially after my surgery, and, making all my appointments and, making sure I had someone to go with me each time. I would be like, I just say, you guys are talking about me. You're talking about me. This is me walking through. It's almost like an out-of-body experience for me.
Right.
It was like, and today sometimes it is too. Because I remember too, I know I didn't share much about my losing my hair story. After my first chemo, probably 2 weeks after my first chemo, I saw hair lying around in my living space. Just hair, just over here, over there, over here. And I hated washing it. And my son-in-law was like, just shave it off. And I'm like, no, what if it all doesn't come out, Right. And hindsight says shave it all off at the beginning. So I finally shaved it a month later. And then it took me about another month before I started wearing my bald head. And then when my hair started growing back, I cut it for 8 or 9 months because I liked it short. And it was so easy.
It's very cute.
Just literally get up, go like this, or nothing. Just get up and go. You don't have to, God, it's liberating. Anytime I can cut my hair short right now, anytime, because it's so, but I wouldn't have known that before.
Did you cry when you shaved your hair off, Margie?
No, I cried when I first felt it pulling out of my head. I remember after I saw it laying around on the floor here and there, I was upstairs with my daughter. We were doing something on the floor. And I had already noticed when I washed my hair, you know how you wash your hair? And this hair would just be everywhere. So I hated washing it for that 2 months. And so one day after I washed it, this was probably 2 weeks before I shaved it, we're sitting on the floor and I just did like this to my hair. Just, I just slightly pulled it and I could feel my hair leaving my scalp.
Wow.
And my daughter was like, I can hear it, Mom. I said, but you can't feel it. It And I think that was the only time I cried. Then I was over it. I was like, okay.
Wow.
And then I know my nephew and Tyson. Tyson shaved his head 3 times while I was bald. Oh, he's going back. He shaved his head again. Tyson's my grandson. So funny. And my nephew shaved their head. Several people all shaved their heads, sending me pictures. But after I wasn't, and plus it was in the winter, so I was cold. So I had to get a wig just to stay warm. And then I did the head wraps, and I had 20 hats. Just because it's cold. But then when summer and when spring hit, so by March, I was wearing my bald head. And then it just starts growing back slowly. And I liked it short. So I just went to a barber.
It looks very cute. And as it grew back?
Huh?
Is your texture different as it grew back?
You know what? My texture didn't change. I get that a lot. A lot of people ask me, I'm like, oh, no, I think it's the same. Yeah, it's pretty much the same. And right now, it just transitions right now because I'll do my twist and they'll lay flatter. And then by the end, what's today? Thursday? So probably by Saturday, this will be like this, a big old afro. The hair just kind of, like Diesta's. It'll be more afro-y like in the 70s. And then I'll just twist it down or braid it down, braid it for a couple days and take them out. And I'll probably get braids put in next month or later this month. Because usually during the winter I wear braids and during the summer I wear my hair. But yeah, going bald was the best thing for me because I would have never done it otherwise. I would have never just said, shave your head. No, I wouldn't have done it. Nope, not at all. But now I was like, I'll do it anytime. Because it grows back for one, and if it doesn't, so what? But I got tired of going to the barber, guys. I had to go like every 6 weeks. My hairstyle, there's some of my short hairstyles are on our ECANA website. That's why I'm wearing it short.
Margie.
Yes.
You have a joy about you that is beautiful to see. And I just have to say, you and Bridget are like 2 peas in a pod when it comes to that. Because both of you just have that effervescence about you that just oozes out of you.
Oh, thank you.
That's amazing to me. Bridget, until January, Bridget was my neighbor for 35 years.
Oh,
so we're
really?
very close. Yeah. And so I'm very much a part of her story. I mean, and I know her story.
Yeah.
But as I hear your story today, I'm just sitting here chuckling, watching you, because you almost look like her, and y'all just have that same joy and laughter about you, which is beautiful to behold.
Thank you. I didn't know.
And you're using something that was a challenge in your life, and you've turned it into a mission, and are helping other people, and that's what's fantastic to see.
Thank you. You can say, I mean, I had no clue. If somebody would have told me 5 years ago that I'd be doing this, I'd be like, what are you talking about? When this started, I didn't even know what an oncologist was. I mean, literally. When I came with my daughter, I said, I'm going to go see an oncologist on Monday. After I just said, my daughter dropped what she was doing. She looked at me and go, Mom, they think you have cancer. I said, how do you know? She said, like,
no way, Margie.
Oncologist. I know, Martha Jean, that's bad, but that's how far right or left, whichever, backwards I was.
Oh my God.
Because you're going to see an oncologist specialist. That's why.
I tell you what, before I was diagnosed, I've never met a woman with this before.
Yeah, me either.
Never.
Never heard of it.
Never heard of it.
And Martha is part of our steering group team with ECANA. And
Yes.
Martha Jean, you live in?
New Orleans.
New Orleans. I was going to say Orlando. New Orleans. Yeah.
Yes.
And you're up this late supporting us. Thank you.
Okay, I have a question. I have a friend that has cancer. It isn't endometrial cancer, but you know, I want to know from you, somebody who's been through cancer, how can I support her? Hers is 4th stage, and she's gonna eventually die from it.
Oh, so she's in palliative care. Does she know that?
She's in what?
Palliative care? Will they just try to keep you comfortable?
She's not that bad yet.
Oh, good.
She's been getting tests and something about levels and things like that. And she's, you know, she believes in prayer, and we keep praying for her, and her levels end up being okay. And she asks for prayer every time she goes, which is really good. But
is she able to move and function and live life?
yeah, she was an avid hiker. I mean, she was climbing mountains before. And it's really affected her because it's in her lower back. So it's affected her ability to do a lot of hiking. But she still does it anyway because she just loves it, and she refuses to stop until she has to, you know.
Right.
So
I say the best way to support her is be the one, if you have to, put her in that wheelchair and get somebody with you and take her out. Let her live all the best that she can for the rest of her life. Just live like today's your last day.
Okay.
And just encourage her that way. And just be there as much as you can for her.
Yeah.
Just so that she knows she can pick up the phone and call you, or that you're already there. That I think that support
sounds good.
So huge, right, Martha Jean? Just somebody is just there, and you're not. But I'm not bugging. I don't want to bug her. No, you're never bugging me. I'm here, and let her live the best she can live right now. Whatever she can do, do it. And because I know as soon as I could move, I'm moving. Just move, get yourself going, and do what you love.
Yeah.
That's good advice.
Thank you.
Yeah, for sure.
All right.
Okay.
Thank you, everyone.
Thank y'all.
Thank you, DS.
Give Margie a round of applause. Thank you, Margie.
Love
you. Love you.
It was a blessing to share this,
Jean,
ladies.
Yeah.
This is an absolute blessing. Y'all stay brave and stay well.
Okay.
You too.
All right. Good night.
Okay.
Good night.
Good night.
Thank you.
Thanks,
Bye.
Diesta.
Thank you, girl.
Thank you.